right, hi there. Today we're going to talk a little bit about eye injuries. When we talk about person's eyes, there's several elements to such a small organ. So these pictures will show you the eye and how it looks in the front and all the way to the back. When we talk about the cornea, you can see the cornea is at the outer aspect in the front there. We have the iris, the lens, the pupil, and then back behind you can see where some of the other parts of the eye will occur, such as the retina, the sclera, and back behind is the optic nerve. When we talk about some of the anatomy of the eye, first we talk about the iris. The iris is actually the colored contractile membrane that's suspended between the lens and the cornea in the aqueous humor of the eye. It actually separates the anterior and the posterior chambers of the eye. The function of it is to actually, by contraction and dilation, it regulates the entrance of light. We talk about the pupil. The pupil is the contractile opening at the center of the iris of the eye. It's black. The pupil should be equal. It contracts when exposed to strong light and dilates in the dark when the focus is on a distant object. Then we have the cornea. The cornea is the clear, transparent anterior portion of the fibrous coat of the eye, composing about 1/6 of its surface. That curvature enables it to function as an important refractive medium, and it actually has 5 layers. The lens is just a transparent refracting medium, and the retina is going to be the innermost layer of the eye. It receives images transmitted through the lens, an immediate instrument of vision. Light sensitive structure upon which light rays come into a focus. It extends from the point of entrance to the optic nerve anteriorly to the margin of the pupil, and it's completely lining the interior of the eye. And then our optic nerve will carry the impulse for sense of light. So here's another picture, a more simplified picture of the eye, and it shows all of those different parts of the eye we just discussed. When we talk about the pupil, the iris, the lens, the cornea, the retina, and the optic nerve. What types of injuries do we see? A lot of times the types of injuries that we may see will include an eye contusion or bruise, laceration, contusions and fractures involving the socket of the eye, corneal abrasions and sometimes ulcers, and then foreign bodies. So how do we treat eye contusions or lacerations? If you have someone who has a blunt injury or cut to the eye, most of the time their symptoms are going to be swelling, redness, tenderness, pain. They may have bleeding or bruising in or around the eye, and they're going to have a change in vision. What you want to do with someone who just has an eye contusion is use ice packs for the first 24 hours. The next day you can apply hot compresses off and on, and you want to have them elevate their head while they're sleeping. And then when it comes to lacerations around the eye, they may require steri-strips or sutures. So based on your laceration care and exposure with that, making a determination of whether this person needs to have steri-strips applied or possibly be sent out for suture care. Contusions and fractures involving the socket is going to be more of a direct blow, may shatter the facial bones that form the orbit or socket holding the eye. It may be stable or it may be unstable. The muscles, tendons, nerves of the skin may be involved, and there's going to be pain, swelling, numbness, inability to move the eye normally to see clearly. At this point, you don't want them to rub, you don't want to wash the eye, you want to cover both eyes so that you can stabilize the injured eye, and probably will need some type of surgical intervention if there is some instability. So if you do have somebody who has a direct blow to the face and it involves that orbital socket around the eye, and you're noticing that there's quite a bit of swelling and there's quite a bit of bruising right away, that means there's internal bleeding going on, and those will need to be evaluated outside. My suggestion would be is to contact your company physician for guidance on referral, or if you already have something set up for your site, that you can reach out to them and get them immediate attention. But the best thing to do is, if there is some instability and they don't have the capability of moving their eye, that you do go ahead and stabilize both eyes, because they will work together, and by stabilizing the other eye, it will keep the other from moving around. Corneal abrasions and ulcers. So typically with corneal abrasions, they do have some significant eye pain, sensitivity to bright light, and then eyelid spasms, or a lot of tearing, blurred vision, and then redness. Ulcers are usually curable with some type of antibiotic drops that are going to be administered by ophthalmologist or an optometrist. And so if you have somebody locally that you can depend on and have something set up with, that you can contact them and have them evaluate someone if you think that they may have an ulcer, then I would have them referred off to them. If you have someone you suspect has a corneal abrasion from maybe a foreign body that was in their eye and is now removed, cold water compresses may help relieve the symptoms. Also making sure that the actual foreign body has been removed and is no longer present. And then going ahead and putting some type of moisture redrop in their eye and possibly covering it with an eye patch for the day. The best thing for corneal abrasions is for a person to keep their eye closed, because the eye will heal itself quite quickly with it being mostly water and a little bit of protein. And so as the eye is closed, it will actually allow the eye to heal over quickly. Foreign bodies that may cause corneal abrasions, when they're still in the eye, will cause some severe pain, redness, irritation, and that scratchy sensation. It may be felt with every blink, or it may be felt all the time. What you want the person to do is not rub their eye. You want them to keep their hands away from their eye. Keep their eye closed if possible until you can get them sat down and take a look. You'll want to use eye wash to try and remove the foreign body by flushing the eye, and always flushing from the inside out. Also, you want to see if you can see the foreign body, and if it doesn't come out with flushing, use a moist Q-tip, making sure that that Q-tip is moist, and then once you are able to remove it, apply some mineral oil or some type of re-wetting drop again. One of the big things is sometimes you may not see the actual foreign body on the eye, but if you have the person look down and you take and lift their eyelid up, sometimes it will be actually up underneath on the eyelid, and by removing that, again, will relieve them from the pain and sensation by removing that foreign body. A picture of a foreign body here in the slides, you can see where there's just a small black dot. Sometimes you may see that on the eye, sometimes you may see a little area where it looks like there was something, and then that's the abrasion itself, and there's no longer any black or other material there. This shows going ahead and opening a person's eye, lifting up the eyelid and being able to remove that on the top of their eyelid. When we talk about penetrating wounds, the major types of penetrating eye injuries are eyelid lacerations, corneal lacerations, scleral lacerations, or perforating trauma with either something that is still impaled or an occult foreign body penetration when metal strikes metal, getting some type of penetrating wound like that. Again, if you have an impalement in the eye, make sure that you are not removing it. Instead, stabilize both eyes and get the person to the emergency room. Flash burns, pain usually about 4 to 8 hours after exposed, and severe dryness in the eye. The pain is associated with that dryness. So if somebody has some exposure to welding, they typically will not feel it until that 4 to 8 hours later. A lot of times it's after they've already gotten home and gone to bed, and it may wake them up in the middle of the night. The best thing that persons can do is to lubricate their eyes and get back to sleep and allow their eyes to heal overnight. Certainly if you have somebody who's in severe pain and after speaking with them and assessing them, if they need further treatment, then I would have you contact, again, your optometrist or your local ophthalmologist for treatment. Just a little bit of eye trivia to finish up today. When we talk about the composition of the eye, it's 65% water and 35% protein. And the average duration of a single blink is about 0.3 seconds. The average human eyelash lives about 150 days, and the average eye can distinguish about 500 different shades of gray. The human eye is continuously but imperceptibly moving, so muscle contractions cause it to quiver 30 to 50 times per second. The human eye can perceive more than 1 million simultaneous visual impressions and are able to discriminate among nearly 8 million gradations of color. That's all I have today, so thank you and be safe.